This is Dr. Farrago with Dr. Anderson. This is episode 4 of the, I guess we're calling it the Central Virginia Direct Primary Care Show. Dr. Anderson is over in Boonsboro. I am over in Forest Direct Primary Care. It's different than regular primary care in that we are a monthly membership subscription, but we deal with people all the time by email, texting, and that's why telemedicine has worked really well for us. We only keep around 600 patients. I'm right around there. Dr. Anderson is getting close to being filled. Sounds like a lot of patients. It's actually very small. Most family doctors in town keep about 3,000 patients. So we just try to keep very intense care with our patients, try to be as complete as we can and not be overwhelmed so we can do a good job. How to explain that before we start, because some people don't know who we are and why we're talking about this stuff. This is mainly for our patients. Dr. Anderson, how are you doing today?
We're good over here at Boonsboro.
Okay. So a couple things. We see the video and I see your Boonsboro sign. Mine is of bookcases in my house. I am not in my house every day. You're not in the office every second. It just shows on our videos. I go every day to the office. I just have to be, it's better filming for me at home. You're coming to the office and you're seeing some patients when they absolutely have to be seen, but mostly telemedicine, correct?
Yeah, and we're doing mostly telemedicine over the phone, over video, and we're also trying to preserve our office as a extra clean place.
Yeah.
So those high-risk patients can come here when they need to, and other patients obviously too, without fear that they're going to get infected here at their doctor's office.
And we're both very careful. I shared that in an email with my patients that when a patient had to come in for sutures, I had to gown up completely because, if I do that for every situation, then I only have so many gowns and so many pieces of gear for protective equipment. This is the shortage we have in America. Us primary care docs are not prepared for pandemics. So we only have a certain amount. That's why I can't see everybody like in a regular visit, because we've got to scrub the place down. One thing we don't want our offices to be is a vector or a source of infection transfer from one to another. This COVID thing is very, very contagious, correct?
Sure is.
Yeah, I mean, if you look at what they did with, just as an aside, they screwed up the whole, I think it's the USS Comfort that came out to New York City, that massive Navy ship, and they mistakenly had 4 or 5 patients they didn't realize had COVID, went onto the ship. It was supposed to be a COVID negative ship. Now most of the crew there is COVID positive. So it is very infectious, and which is very sad. So let's go over what's going on. I will start by saying that in town, we know that we've had up to about at least 10 patients now on ventilators in the ICU here at Lynchburg General. I think it was down to 8 the last I heard. They only give me a weekly summary. I have some sources that give me a more regular summary. I think we've had 2 extubated, which means they've come off the ventilators. We've had at least 1 death from COVID in town. Have you heard anything different?
No, that's about what I'm hearing as well. And then there's obviously some other cases that are in the hospital, but not in the ICU. Right.
And so testing is another issue. You cannot get everyone tested. There's not enough tests in this small town even though we don't think Lynchburg's that small. I've had patients that I know were positive, all the symptoms, even a fever, and they can't get tested. And yet I've had patients go to Winston-Salem and didn't even have a fever, didn't even have some symptoms, definitely as positive as some other patients, and they get tested in the ER there. So there is not a strategic or consistent method of testing, correct?
No, it's pretty regional, it seems. And that is dependent on...
And that screws up the denominator. So the bottom line is there's a lot more positive. So we'll go back to almost the last video. Assume everybody is positive so that you stay away from people.
Yeah. Governor Northam has jumped on the bandwagon, rightfully so, to recommending that we mask when we go out in public. And I urge my patients and pretty much everybody I come in contact with in my office and otherwise to mask up when they go out in public. It's just going to help the social distancing.
And so this agreed 100%. Holding onto my hand so I don't touch my face. I think I've been pretty good so far today. Okay, so people get sick. Some people don't get sick. You know, this is an asymptomatic transfer, which means people without symptoms can give it to others. Some people have very mild symptoms. Some people get really ill, and we're not sure exactly why or who's more susceptible. However, we do know the more other medical problems you have, the higher risk. We do know that the older you are, the higher risk. And then when things go bad and they're in that ICU, weird things can happen to their lungs that have fooled us. So I think you've looked into that a little bit. Tell us more about that.
Yeah, so I like the science of all this. I kind of get inundated with all the numbers that the news throws out, and this many people have it, and there's this many cases, and I just turned that off a little bit, and I studied the science behind it, and that's what I enjoy. And so I started looking at what's called the pathophysiology behind the virus that causes COVID-19. And so that's just pathophysiology. That just means how the bug works in the body when it infects the human body. And so at first, the best way to describe this is kind of how we came across this in the medical field. So people have what's called a pneumonitis. That's what this is. It's inflammation of the lungs. And that's a general term, but that's what it is. And we thought initially it was an infectious pneumonitis, which means it's caused by a virus. But that usually happens on one side or it happens on both sides of the lungs. If it's infectious, if it's caused by a virus. This one has been 100% of the time, both sides of the lung. And so they started looking into it more as to why that was. And it turns out that the infection gets into the red blood cells and disrupts the hemoglobin. That's the protein that holds the iron. And the iron is responsible for holding on to the oxygen, and that's how we can get oxygen transfer in our body. And so it disrupts that, and in process, it causes this iron to be released. Iron is really bad to be free floating in the body. And so your body has some mechanisms set up to pull that out of the system. One of those is the macrophages in the alveoli. Those are the lung tissue, the lung cells. And they gobble up the iron. Also downstream, the liver also filters this out. And both of those systems become overwhelmed pretty quickly. And because of that, you get these iron, which is free radicals, and to a huge level. And that is what causes the inflammation in the lungs. And I say that all because that has shifted how, one, we understand the enemy a little bit, and two, how we can address it more effectively. And so some of the things that we've noticed is that people aren't responding to ventilators and ventilator management the same way they usually do in the typical ARDS patients. And so it is because not only are the lungs damaged, but the mechanism to get the oxygen from the lungs to the vital organs is also damaged. And so we are starting to shift how we address that second part of the puzzle so that we can better do that. And the ways that we're looking at now is possibly hyperbarics, which is oxygen under pressure. There's these things called hyperbaric chambers, and it's kind of like a fishbowl that you can get inside, or they even have some that are as large as rooms. And it's high pressure oxygen, and so it can force the oxygen where it needs to go and circumnavigate the red blood cells to a degree. The second thing is just blood transfusions. Give them fresh blood that hasn't been affected yet so that they can get the oxygen where they need to. And
yeah. All right. So this is like, even, you know, I'm hearing this stuff and I'm trying to relate this to the general population, and it's just where our thinking is going. However, locally it's not being done. And then, so if I'm a regular patient, how does that affect me? Should I not be doing iron? I'm not sure that really should change anything patients do on a regular basis.
No.
Other than and again, anything I can find to give patients for recommendations. I do hear that vitamin D helps immunity. I'm recommending sunshine. If you look at the pandemic of 1918, they had all patients out in the sun. I think there's something there. I think you have to be very careful. For example, this is why I like to talk to you on this stuff, because you're a really smart guy. And also you can, hopefully I do as well, sift out the absolute crap of information that's coming out there that's not real. So you've heard this before, and I'm seeing videos that are like, wait a minute, that's not right. And I'm seeing articles written by people that are not even physicians. They're chiropractors, they're functional medicine something, but they're not even doctors. And they're writing like, you know, if you just buy my supplements, or if you just try whatever. Are you seeing that as well?
Yeah, so I've had a lot of patients, and I have invited some of my patients to send me articles, videos that they've seen, and I got one yesterday, and it was this non-physician, non-PhD, somebody who just wasn't really educated, but was very much pandering, maybe some fear-mongering a little bit, and just really sensationalizing things, maybe to get them to buy supplements or to listen to further videos and maybe come to their clinic, and just things that weren't helping. So my caution is, and I think this is what you're talking about, is just be very careful where you get information from. If they're telling you to do something, be sure to check their sources.
Yeah.
And some of the reason I mention the stuff about the pathophysiology is just things are happening. We're learning things, and that's a sign of that's hopeful.
Yeah.
And that's a sign that things are moving in the right direction. And then to go back to what we were talking about earlier, please check the sources. If somebody's telling you do something, look at why, and make sure you can explain to yourself in very clear terms why that makes sense or why it doesn't make sense.
Yeah,
there's a lot of stuff out there.
I get those too from patients. I can't see, I mean, I get it all the time, and I try to just scan over every article, and it's hard, and because they sucker you in with some reality, and then they threw some of this crazy stuff in. And listen, I'm not closed minded to alternative therapies. I mentioned one before, basic, which is not alternative. Using the sun is, I think there's some benefits there, and I think we're going to find that out. And there may be some relationship with low D and severity of disease. I don't know that yet, but I can tell you that I've heard at least 20 different treatment regimens that are questionable at best. And I can tell you that I look at these things very carefully. There's some that definitely tweak my interest, and I think maybe something there, but I'm hesitant to even say it here because I can't really officially or confidently say, yes, you need to be doing this. And I think you and I are on the same page on that.
Oh yeah, and there's even stuff coming from legitimate sources that are just not curated the way things typically are. I mean, we're going at this all backwards because we're scrambling as a planet.
Right.
We are just taking this spitball approach where you throw something against the wall and see what sticks. And that's what we're doing. We're taking what we know about science. We're taking what little we know about the virus, and we're combining them together. We're doing tons of trial and error, and we're publishing it as fast as humanly possible and hoping it comes out in the wash. And the difficult thing is that citizens and lay people and physicians alike are stuck in the middle, where we're trying to figure out what's real, what's false, what is more real, and what is more false. That's kind of where we're stuck right now.
Right.
What's better and what's less better at this stage, because right now we're scrambling as a planet, and so it's just not curated the way stuff usually is in the medical literature.
I guess the example I think I've heard this, but I think it's Apollo 13, where they had to scramble to figure out how to get these guys down, right? And so you imagine what those scientists had to go through to figure that out. And they didn't have time for studies. They had to work through the equations and figure out a way to get those guys down. Now, imagine what social media was involved and trying to give them advice at the same time and spreading false information with Apollo 13. See, things have changed a little bit. We can't let the right people talk about this. However, that being said, I believe there's good news. So a couple of things I think are good. Italy is kind of flattened out and coming back. New York City, it sounds bad, but I think they're flattening out on cases. It looks like when we discussed, we were talking one point, May, late May. Now it looks like we're peaking in Virginia. I'm hearing April 20th. You hearing that as well?
Yeah, it's moved up by about 3-ish weeks.
Yeah, this is great news. I mean,
That is
social
good
distancing
news.
should help. So there is a lot of positive where our system has not been overwhelmed in Lynchburg. Hopefully it won't, because today is already the 10th. So in 10 days, and we only have 10 in the unit, let's keep our fingers crossed, and hopefully things will be better. But we'll try to keep giving information to the public here through Facebook, at least to our patients. And so we'll talk again next week.
Yeah.
All right. You stay safe over there in Boonsboro. If people want to know, boonsborodpc.com or forestdpc.com. Guys, everybody out there, stay safe. I'll talk to you next week.
Take care.